want to thank the Focused Ultrasound Foundation for the opportunity to present our work titled Site-Specific Symptom Improvement After Globus Pallidus Focused Ultrasound Ablation in Parkinson's Disease. I'm Vibhor Krishna. I'm an Associate Professor of Neurosurgery at UNC Chapel Hill. These are my sources for funding, and the ones that are relevant are highlighted in bold. Parkinson's disease is the second most common movement disorder in adults and is also the second most common neurodegenerative disorder. It has a prevalence of about 0.3% in the US general population. Parkinson's disease presents with tremor, bradykinesia, rigidity, and imbalance and creates significant physical disability. Majority of Parkinson's patients develop motor complications such as motor impairment in off state, also called fluctuations, and dyskinesias. Deep brain stimulation surgery remains the gold standard treatment for patients with Parkinson's disease and motor complications. Given the invasive nature of DBS and underpenetrance in patients with Parkinson's disease, focused ultrasound ablation of the globus pallidus was tested in several clinical trials. We participated in a phase 2 clinical trial of globus pallidus focused ultrasound ablation in 20 subjects of Parkinson's disease who had significant dyskinesias. We reported an improvement of 44% in off-medicine motor impairment score and 59% improvement in the dyskinesia score. Based on these results, a phase 3 randomized trial was launched in Parkinson's disease subjects with motor fluctuations and dyskinesias. This was a randomized, sham-controlled trial with blinded assessments, and the results are expected to be published soon. The therapeutic target for ablation in Parkinson's disease is the globus pallidus, which is roughly 10 by 4 by 8 millimeters in size, and it is a functional relay. Globus pallidus receives significant afferent connections from the putamen and in turn has pallidothalamic outflow. Medially, it has the pyramidal tract, and inferiorly, the optic tract is surrounding this nucleus. On conventional radiographic imaging, the motor subregion within globus pallidus is difficult to identify. We asked two interrelated questions. First, how can we map the motor subregion of globus pallidus in patients with Parkinson's disease on an MRI scan? And are the symptom improvement after globus pallidus focused ultrasound site-specific? We published this work in Journal of Neurosurgery recently. For this project, we had two cohorts. The imaging cohort had healthy controls from the test-retest subjects of the Human Connectome project and patients with Parkinson's disease who underwent MRI imaging. Globus pallidus was parcellated using diffusion MRI based on the magnitude and direction of water diffusivity as measured by orientation distribution function. Individual parcels were then used as seeds for tractography to distinguish the motor from the non-motor parcels. In a separate cohort of patients undergoing focused ultrasound ablation of globus pallidus, we identified the lesions on postoperative imaging and superimposed those on the globus pallidus parcels. We then calculated the hotspots for improvement in motor impairment as measured by MDS-UPDRS subscale 3 and dyskinesia as measured by Unified Dyskinesia Rating Scale. We identified three distinct parcels within the globus pallidus, the posterior, central, and the anterior, shown here in red, green, and blue respectively. The posterior and the central parcels were classified as motor, while the anterior parcel was classified as anterior. There was a high reliability in GPI parcellation in test-retest imaging. The shape and the location of these parcels were stable, and this parcellation was preserved in patients with Parkinson's disease. We then looked at the clinical outcomes and observed an improvement in dyskinesia by 54% and motor impairment by 30%. Based on these clinical findings, we identified two distinct hotspots for improvement in motor impairment score and dyskinesia improvement. The hotspot for improvement in motor impairment as measured by MDS-UPDRS-3 was more posterior and ventral, while improvement in dyskinesia hotspot was more anterior and dorsal. Overall, using diffusion MRI, we identified a unique signature of motor subregion in patients with Parkinson's disease, which was distinct from the non-motor subregion. Two symptom-specific hotspots for improvement in motor impairment and dyskinesia were identified. Overall, these findings should be tested in future studies and may have implications for personalized therapeutic targeting of the globus pallidus to treat Parkinson's disease with focused ultrasound. Thank you.